Well, with me now is Dr. Ian Soosay. He is a psychiatrist and honorary senior lecturer in the Department of Psychological Medicine at the University of Auckland. He's also worked in a number of post-disaster settings, including Aceh, East Timor, Christchurch and Kaikōura. And he's currently a technical advisor to the WHO on mental health services for difficult-to-reach populations. Ian, welcome to the program. We've just seen some first-hand experiences of people who have been through these cyclones and flooding there. But what psychological symptoms do we see arising after disasters?
Well, look, people have been through a terrible experience, losing their homes, losing their income. Some people may have lost loved ones. And so it is extremely common and highly prevalent to see a range of symptoms. So, for example, if you think about what our normal response to a dangerous situation is, that's the sort of experiences that people have. So they'll find it difficult to sleep. They are hyper-aroused, which means they're more sensitive. I don't know about you, but I keep looking at the weather forecasts. You know, they'll be worried about every single storm that comes. They may find that they are a bit more withdrawn. And they may even have, if they've been through a pretty scary experience, they may even have sort of flashbacks where they may find themselves kind of reliving some of those, the experiences they've had. So we call those post-traumatic symptoms, and they are actually incredibly common.
Yeah, and that's the point of a post-cyclone mental health plan or a mental health plan around disasters, isn't it? Is to get that support to those people early. That's important. Yes,
but you want to do a number of things, and the Minister was quite right that we often see, people who respond to disasters are quite organised. So we see a response phase and a recovery phase. And the reason we have that is that we don't want to send in counsellors while people are, still rescuing people from buildings and things like that. So a phased approach is a very sensible approach. However, every disaster is a bit different, and therefore what we often recommend is that governments and services adapt to the disaster in front of them. And in my view, the cyclone is quite a complex disaster. We are seeing, the timeline has been spread out. So we had the Auckland floods and then the cyclone. Geographically, it's spread out. The type of communities and the services they have in place are also quite varied. And so my kind of recommendation is it's always good to have a plan. One of the problems often governments face in these circumstances is everyone wants a really good plan. And what we say is, look, you need a good enough plan to begin with, and you need a plan that evolves over time.
Well, the Minister has said that she's got this work going on with officials. It's going to be about a month. Is that adequate, do you think? So,
if I was advising the Minister, I would say that you'd want a plan a bit early on. So the governments, and we don't see it, have constraints. They have, they have to go to Treasury, they have to get money available, they have to put things in place. So elements of the plan will be longer term and will need further workup. But right at the beginning, there are lots of things you can do. So for example, some of those symptoms we talked about earlier don't necessarily need mental health professionals. So you have people moving around in insecure housing. There's a lot of interventions that can be done early on, which are kind of quite simple. The other thing that's really important to do is to understand who's being affected and identify gaps, because disasters tend to show up weaknesses in our system. So early on, if we, for example, in Kaikōura, I thought that was a really good response. People on the ground were really good. We very quickly identified that the Pacific, the workers from the Pacific were not included. They had particular barriers to access. Similarly in Christchurch. So you want to try and address some of those things early on.
To find those gaps, and then you can sort of plan resources around them, I suppose. The Minister talks about the primary system meeting the need right now. But will they need backup from more specialised services in some of these places like Tairāwhiti, for example, with psychiatrists and psychologists, which it can be hard enough to get here in Auckland or in the major centres?
Yes, so I mean, firstly, I'll just say places like Te Rāwhiti have some pretty innovative and interesting services, and I've been involved in some of these the development of the primary mental health services, and they are great. I think we've done really well in introducing them. What I would say is, firstly, do we have universal cover? So the example I gave earlier, you may have families who have to, who are relocated from, in Auckland, for example, they may be in West Auckland, but because of insurance, they'll have to move around town. Now, many of these services, firstly, they're not comprehensive, so they don't exist in every primary care service. And there are restrictions, you have to be an enrolled patient in order to access them. So if somebody is moving around, they may not be entitled to these services. So these are the sort of things, when I say you want to stress test the service, that's what the minister should be looking out for. Again, WHO talk about universal health coverage. And what is our universal mental health coverage? So that's the first element. And the second element is, if you have gaps, then the only kind of show in town is specialist services. So you will end up putting pressure on them. But also disasters increase the prevalence of severe disorders, and we tend to see that over the course of 10 years. So unlike vaccinations, where you kind of vaccinate people in at the beginning and you're done, with mental health what we tend to see is it emerges over time, it waxes and wanes, so you need services that are stood up to support the community.
In both the short and the long term. Dr. Ian Soosay, thank you so much for joining us here on The Nation.
Great, thank you.